2025 America. Are you of the belief that everybody is addicted to something, whether it be sugar, processed carbs, alcohol, gambling, pornography? Is everybody addicted to something in our modern world?
I started my career as a cardiologist. Didn't take me long to get a little kind of frustrated.
What does metabolic health mean? Because I think we toss terms around. We do this as traders all the time. We'll throw out terms like your risk to reward ratio has got to be here.
My mental state, my physical state just feels bad on the days I don't get exercise. So maybe that is my addiction.
I don't want to get political because I'm not political in this particular statement.
How people can change their lives, improve their health with ketosis.
Do you think it will or won't? Are you glad he got confirmed, Dr. Scher?
Oh, 100%, because he is the only one who's been saying...
Welcome to the Future's Edge show. I am Jim Iuorio. That's Bob Iaccino, the show that critics have called, Bobby, what did they call it again? The guy said we were smart and irreverent or something like that.
Smart and irreverent were the
yeah,
ones
we
I
liked
remember.
that. We liked that a lot. That's what critics say about the show. Now, some of you watch the show a lot, and you know that 60-70% of the shows we do are financial, economics, trading shows. We go into health. Bobby and I both believe that metabolic dysfunction in our country is a massive economic problem, not only just a massive health problem. It is, for someone like me, just where my situation is, I coached youth sports for 25 years. Something very, very strange happened over those 25 years from when I started in 1988. When all of a sudden kids weren't in the same condition they were before. Something had to be happening. We're trying to get to the bottom of it. We've had Dr. Robert Lufkin on talking about the lies he taught in medical school. His book, Dr. Scher, by the way, are you familiar with Dr. Lufkin and his book, The Lies I Taught?
I am, yeah. And I see him a lot on social media. Yeah.
Good. Yeah. So we had him on. We had a really nice show too. Bobby and I are both relatively carnivore. Bobby is more so than I am. I'm like 70% good fat, protein, the other 30% vegetables, and occasionally I break down and have some whole fruit. Bobby's more disciplined than I am, but my life has absolutely changed. The only reason I ever stop my workouts now is because I got to be somewhere. Otherwise, I would just work out all morning long, and I'll be 60 this year. But anyway, what I've said before, Bobby and I are both cast-offs from mainstream legacy media for 20 years. Every time there, realized we were at the whim of some overzealous producer or sponsor that told us what to say. We don't like being told what to say. You might think our opinions are bullshit, but when we give them to you on this show, they are our honest opinions. This is a massive show to me because I think the work that you guys do, Metabolic Minds, I think is groundbreaking. I think in 20 years, everybody will be like, what the hell were we doing for those 50 years from 1970 to 2020, where everybody was eating like shit and it caused massive health problems? But he is Dr. Bret Scher, MD of, do I pronounce that the Baszucki Group?
Baszucki Group, right.
Baszucki Group, and host of the Metabolic Minds podcast. Can you tell us a little bit about yourself, Dr. Scher? Like where you went to med school, how long you've been in practice, things like that?
Sure. Yeah, I'd be happy to. Thank you so much for the opportunity. And I sure hope you're right when you say, we're going to look back and say, what have we been doing the past, 50 years? And boy, were we wrong. So I sure hope you hit the nail on the head there. But yeah, a little background about me. I went to medical school at the Ohio State University. California kid, though, so I came running back to San Diego for my residency and fellowship. I did a fellowship in cardiology. And interestingly, it was a combined general and preventive cardiology. And the preventive part was in an Ornish-style program. So, with a very low-fat vegan diet being sort of the centerpiece, but with also the exercise and the group support and the stress management and so forth. So it was an interesting start. And then I started my career as a cardiologist. It didn't take me long to get a little kind of frustrated with the impact I was having compared to the impact I thought I was going to have. So after about 10 years of practicing, I continued to practice, but I opened a wellness center called Boundless Health, thinking that I just needed to have a little more time with my patients. But fortunately, the head coach and trainer who I was working with there was very knowledgeable about ketogenic diets and low-carb diets. He helped educate me and sort of challenge me to learn more about it. And once I did, that put me on a whole new trajectory, realizing how important metabolic health was. And I think previously, maybe I didn't focus so much on metabolic health because I didn't know how to fix it, right? You're not going to fix it with the drugs. and you tell somebody to eat less and move more, that doesn't work. So how are you going to fix metabolic health? But once I saw the tool in the toolkit with low-carb and ketogenic interventions, everything changed. So from there, really changed my practice to focus still on cardiology, but with a whole new approach to lifestyle. Eventually still got, disenfranchised with the medical system. So left the medical system, became the medical director at Diet Doctor, and then established my own telemedicine consulting practice. And then after Diet Doctor, transitioned to Metabolic Mind, where I am now, and still doing the telemedicine consulting practice. But basically the synergy between Diet Doctor and Metabolic Mind, it's all about communicating about ketosis as a medical intervention, how people can change their lives, improve their health with ketosis. With Diet Doctor is more sort of a general. With Metabolic Mind, it really is focused on the practice of metabolic psychiatry, of brain-based disorders, of really just changing the way the brain works with ketosis. And it's really dramatic. I mean, not a day goes by where we don't get some sort of a report from an individual or a family member saying, thank you, you changed my life, you changed my loved one's life. And that's, it's remarkable. And then from there, we're helping, further the research, we're helping further clinical guidelines, clinician education, and really just trying to elevate this whole concept of the importance of metabolic health, the connection between metabolic and mental health, metabolic and cardiac health, and how ketogenic interventions can really revolutionize the treatment.
This is so nice hearing you say these things that we are totally devotees of. And just a quick aside too, is that about a year ago, I started to get into the Dr. Lufkin, who wrote Lies I Taught in Medical School. I know you know that. I'm talking to people watching. And there's not a day goes by where I don't get a text from somebody saying, I'm so glad you turned me on to Dr. Lufkin. I like getting the credit, despite the fact that he's the doctor who wrote the book, but I'll take the credit any day. Before we dive into some of the things you said, I have a quick question for you about 2025 America. Are you of the belief that everybody is addicted to something, whether it be sugar, processed carbs, alcohol, gambling, pornography? Is everybody addicted to something in our modern world?
Yeah, that's a really interesting question. I've never thought of it that way in the absolute, that everybody is addicted to something. I'm trying to think what I'm addicted to. Maybe it's exercise.
I can tell what you're addicted to right away. It's definitely exercise. It's just like you are just like Bobby and I. You get on the treadmill, you get in the weight room, and that's where you get your fix, right?
Right. And days that I don't get it, like I know, I just, my mental state, my physical state just feels bad on the days I don't get exercise. So maybe that is my addiction. So maybe in that way, most people are addicted to something. I think for the majority of the population, though, it's not a good thing. For right. Maybe what we're talking about, it's a good thing.
I always think of the Bob Dylan song, you got to serve somebody. It might be the devil, it might be the Lord. And I'm thinking, 150 years ago when people working in the fields all day and worry about staying alive, they didn't have the luxury of being addicted to something. You just got what you got. Modern 2025 is a different animal. Bobby?
They were addicted to staying alive.
Yeah.
So I want to ask a couple of simple and obvious questions, because we also had Dr. Sean Baker on here. His background is as an orthopedic surgeon. We had him on twice, and he wrote the book, The Carnivore Diet. I hate the word diet. Okay, sure, I just hate that word, because people come up to me and they go, "You're on that weird meat diet, right?" And it's strange. Jimmy says I'm more disciplined. I'm not. I'm probably less disciplined than him. I've known him for 25 years. It's so freaking good. But that's not the question. What does metabolic health mean? Because I think we toss terms around. We do this as traders all the time. We'll throw out terms like, your risk to reward ratio has got to be here. People are like, yeah, of course. And they don't know what it means. So what is metabolic health?
Yeah, you said it's a basic question, but it's a really important question, one that the medical field actually frequently gets wrong. I mean, when I was in training, metabolic health was basically either you have type 2 diabetes or you don't, right? If you have type 2 diabetes, you're metabolically unhealthy. If you don't, you're metabolically healthy. But that is so short-sighted. But I think that lays the foundation for what the definition is. It's how your body takes in nutrients, metabolizes them, and what it does with them, right? And so how efficiently and well can it do that? And in type 2 diabetes, it doesn't do it well because your blood sugar is really high. They tend to store a lot of excess body fat. So, but now metabolic health, really, we need to understand it far before type 2 diabetes. And it's kind of synonymous with insulin resistance or insulin sensitivity, right? So metabolic health would be insulin sensitivity. Metabolic dysfunction would be insulin resistance. So it's basically how hard your body has to work to take in nutrients and use that effectively and efficiently for energy without negative consequences. So the perfect example is someone who doesn't have type 2 diabetes, but is not exercising very much, not getting a lot of sleep, and eating the standard American diet, but you test their blood sugar, and their blood sugar is okay. But it's because their insulin, their pancreas is cranking out insulin to work overtime to keep that blood sugar in a normal range. That's the perfect example of poor metabolic health that we frequently don't diagnose. So, there was a recent study that looked at optimal levels of metabolic health, and it found that only 7% of Americans had optimal level of metabolic health.
Wow.
93% had some form of poor metabolic health. And you can measure that by blood tests, triglycerides, HDL, fasting insulin, blood sugar. You can measure by a waist to height ratio. And there are other ways, but those are sort of the most common. But at its core, it's just about how we interact with our environment, how we take in calories and nutrients, and how effectively we can use those for energy without storing them from adipose or causing unhealthy effects.
Okay, so this is one of the reasons I asked that question. It took me a long time to understand, believe it or not, insulin resistance and insulin sensitivity, because it almost seems counterproductive in its etymology, for lack of a better word, because I liken it to wires, right? Or even needles. A large number is a smaller needle, right? And a small number is a larger needle because it represents the amount of times that the needle is pulled through. A 25 gauge, I know this from my days with steroids, a 25 gauge needle is thinner than, a 16 gauge needle. I think it would be the opposite way. So when you say insulin resistance, we're all trying not to have sugar spikes. So that sounds like something that would be good. Can you explain that?
Well, if you're trying to not have sugar spikes, I guess you could say having more insulin is a good thing, but your body has to be able to react to the insulin. That's the key. So your pancreas is what puts out the insulin, but it's what your body does with that, because then your cells, your muscle cells, your liver cells, whatever the case may be, your cells need to listen to that insulin and take in the glucose. But what happens over time, especially when insulin levels continue to rise, you develop more adipose tissue, your cells start to become less sensitive to the insulin. So it can require twice as much insulin to have the same effect. So your pancreas is putting out more insulin, but the effect of the insulin is decreasing. So that makes it harder to control the blood sugar.
Okay, because that's the transmission mechanism that from Dr. Lufkin's book confused me a little bit. Okay, so in a normal, let's say I'm metabolically healthy, which I'm not certain of that, but I'm hoping so. So I eat foods, they produce insulin, the cells react to that insulin and deal with the glucose because they have a good relationship with the insulin. Am I getting it right so far?
Yes.
Okay, so now all of a sudden I eat foods that produce too much insulin. My cells become insensitive or resistant to that insulin. By what mechanism then do those cells then bring on additional fat? I mean, by the way, you guys are watching, a lot of guys are traders. When he says adipose, he's talking about fat. And what mechanism makes those cells take on more fat because they're insulin resistant? Is it easy to explain or is it impossible?
Well, I mean, there's never one mechanism, right? We like to say, here's the one thing that happens, but it's usually a cascade. I think the easy answer is you have so much excess energy and so much excess blood sugar that you need to do something with it. So you tend to store it, and you can store it either in fat cells or, unfortunately, you can store it in organs as well. And that sort of constellation of effects can make it so that you're not listening to the insulin as well. A lot of people make the analogy of if you listen to music too loud, your hearing starts to get a little worse. You need it louder for the same effect. Or even like a drug. Yeah. Or even as you start to become adapted to a drug, you need higher and higher doses of the drug to have the same effect. It's like a similar analogy.
So my follow-up to that then is your practice. What is the focus on the broad age range of the human condition, or are you focused more on children? What are you looking at more?
Well, so a couple different things. I mean, so this is where my world gets a little confusing because there's my medical practice and then there's my work at Baszucki Group and Metabolic Mind. So my medical practice is pretty much focused on adults who are low carb and have heart disease or high cholesterol, or are curious about low carb with heart disease or high cholesterol. But my work with Baszucki Group is about ketogenic interventions as a treatment for mental illness. And that spans the whole gamut from kids to adolescents to adults to elderly. But in my medical practice, it's mostly, 20s to 70s that I see.
So my question to this is that I believe talking about this, the mere suggestion that everybody in my generation, I assuming I'm a bit older than you, my kids are older, everybody in my generation to a certain degree fed their kids trash. Everybody of the generation after me seems to be feeding their kids trash. At the time, we believed my kids are running around there on the basketball court all day. Doesn't matter. They burn it off. It's very, very difficult to get someone to say what I just said. We fed my kids trash because there's this psychological barrier that says I could never have done something that wasn't the proper interventions, the proper way to raise my children. How do we get past that barrier? And when you look at the mental health crisis that's going on, how much of it do you think is because of the standard American diet, which is shit?
Yeah. Oh, wow. There's so much to unpack there. But yeah, I remember.
Challenge here, did you, Doc?
Yeah. I started doing triathlons when I was 14 years old, and they had I forget it. I think it was a Dave Scott cereal. He was one of the best triathletes ever.
Dave Scott. Yeah, my buddy beat him in the Chicago triathlon many
cool.
years ago. Yeah.
All right. But I lived on that cereal because it was Dave Scott, right? It had to be healthy. I lived on that cereal. It was absolute trash and junk and sugar that I would never even think about feeding my kid today. So, yes, we all fell into that pattern of eating terribly in the past. And good news is you can overcome it, right? It's not like it's going to ruin you forever. You're right. We have to sort of get past that and be able to acknowledge what we've done, and that it's not always right. That's part of either as a scientist, as a parent, as an individual, to be able to say, whoops, okay, we got it wrong, but we can fix it. We can do better. So, I'm fortunate that my kids are never going to eat cereal for breakfast, right? They're going to have one of the best things my older son did was get into wrestling, which was awesome. I loved when the wrestling coach said, you don't have to eat less. You just have to eat better to make your weight. Eat your proteins and your veggies and you're good. And then you do that, you're going to make weight, you're going to be strong, you're going to wrestle well. I was like, this guy's speaking my language. That's what we need. That's what we need more of. And I forgot your second question because I kind of went off on a tangent.
If I can get more on the keto diet, then I won't forget my questions so quickly because I'll have a sharper mind. Bobby?
Yeah, I want to ask you about, so Jimmy mentioned that I do straight carnivore. And again, for me, it's the easiest one to follow. Now, within my household, myself and my wife both do it, but I convinced. By the way, I had a vegan friend who was really annoying years ago.
So I killed him?
Now I'm the annoying one. And I'm trying not to preach. I'm trying to just leave people alone. But I got on it because of joint pain, and the joint pain went away. My wife got on it because she just could not. Well, now she's on it for joint pain. And then we had a very close family member who had depression. Now, the depression lifted from that particular family member, right, when they went carnivore. And then when they went back, it came back. And now he's back on it again because he said the evidence anecdotally for him was just too strong. For me, it had the side effect that I wasn't trying to achieve of not wanting to drink. So is this part of what, like, I'm in love with the romance of booze. I don't like the effect of booze. I like a glass with bourbon clanking around with an ice cube. I like the taste of it. And then later on, I'm like, why the f did I do that? It's just stupid. Is that part of what you guys are doing in terms of metabolic mind, trying to discover the pathways as to why that works, or trying to see what works best and what doesn't?
Yes, yes to both. And actually, this brings us back to your question, Jim. I remembered your second question now.
That makes one of us remember.
How much of the mental health crisis that we have now is due to metabolic dysfunction? But that ties into your question as well, Bobby, because it's so interesting that a lot of people think you sound like a snake oil salesman when you say, yeah, being in ketosis can help with alcohol addiction, can help with carb addiction. It can help with type 2 diabetes. It can help with bipolar disorder. It can help with polycystic ovarian syndrome. Everybody's like, yeah. One thing can't help all those. Well, yeah, it can, because so many of those things are rooted in metabolic dysfunction. So that's one side of the benefits of ketosis, is fixing that metabolic dysfunction, which clearly has a triggering effect on so many disorders, including psychiatric disorders. But the second part is actually having ketones as fuel in your body and your brain. And this is one thing that's so interesting, both for brain function, but also for alcohol addiction. There's a researcher, Dr. Weirs, who's studying this, and I was fortunate enough to interview her at our Metabolic Mind podcast and YouTube channel. And it's so interesting that the studies she's doing show that ketones, using ketones for fuel, help people crave alcohol less and have fewer withdrawal symptoms. So there's definitely a connection there.
You were on a show with Lauren Kennedy West.
Yeah.
Might have been a year ago or so. I happened to listen to that one right after we sort of communicated to get you on the show. And in that particular episode, you talked about how if you eat, so the studies, obvious that we've seen, a lot of them are epidemiological and they're self-reporting, where it's like, you saw that recent one, meat definitively causes cancer, heart disease, mental illness, acne, shortness, which Jim and I suffer from.
People suffer from.
They just threw it all out there. And then you looked, and it was a self-reporting study where people who ate hot dogs and cheeseburgers with the bun and chips along with the cheeseburgers were included as meat eaters, right?
Yeah. And lasagna and
and all that. Right. It drives me crazy, Jim. I swear to God. But in there, you talked about how, and I want to know the mechanism of this. You talked about how people will eat meat, and then they'll also eat carbs with it. And your body burns the carbs and stores the fat and protein because it goes to the carbs first. What I want to ask you, and by the way, the analogy I use, and you tell me if this is a stupid one, is I tell people when you're barbecuing with briquettes, you try to get the briquettes at a nice, even temperature. And then your kid comes and throws the lighter fluid on there and you see a flame, right? They're no longer keeping the briquettes at an even temperature. It's burning the lighter fluid. That's my analogy I use with people. So what my question is it accurate to say that if you've changed your body over, I've been doing carnivore for 11 months now, I feel like my body's changed over. When I have the occasional cheat day or cheat weekend, Super Bowl, for example, where people brought over pizza and cheeseburgers and I ate them and I felt like shit for 2 days. Does your body crave to go back to that state? Is there like a time window where if you're ketogenic or carnivore or whatever you want to call it, that your body says, no, okay, I'm going to get you back. Just stop effing around.
Sorry, if you're keto, do you crave to go back to the carbs, or
no,
if your
body adjusts back quickly? I had someone tell me years ago that once your body's set in a state, it wants to get to that state. So if my body is used to making and burning ketones and I eat something else, does my body quickly get back to that ketone state if I stop the bad eating, or does it take time?
So that answer, it sort of depends, but for most people, they can get back pretty quickly. Now, those people, if they still have a significant amount of metabolic dysfunction and insulin resistance, it'll take longer. But if someone's been in ketosis for 6 months, a year, chances are their metabolic health has improved dramatically. And then they have a slip up, they eat something they'll usually get back pretty quickly back into ketosis. So, that's why you said you felt terrible for 1 or 2 days. But after that, you probably felt better again because now your body's back to burning ketones and being like, oh yeah, this is what we do. This feels good.
A side note, Jimmy, it sucks because it really screws with my brain. Like I get cloudy and everybody wants to eat bad on Sundays. Right. And I got to work on Monday.
Sure.
It's not like I'm just showing up to nail boards together. I got to think and I can't. Right. Go ahead, Jimmy.
Well, I went from, being 100, and I do triathlons and do a lot of that stuff too, Dr. Scher. And I went from 150 pounds to 137 pounds. I'm 5'8", because of when I started the carnivore light with cold therapy, like a year or two ago. So I was pissed off that I was so small and scrawny. So then I started to add back like some bananas, some carbs, and I gained back 3 or 4 pounds, but I didn't feel good. So then I realized that my body should just be at the weight it's supposed to be at. And I'll try to build muscle as much as I can, right?
Yep, absolutely. I mean, that's one of the, I remember that you still say like, okay, what weight should you be? And like, at 5 foot, you should be 100 pounds. And then for every inch after that, you add 5. That's just a bunch of crap. Throw that out, right? Everybody's going to have their own sort of set point of what their weight's going to be. More important is your body composition and how you feel. So yeah, you hit the nail on the head with your experience. I think that's very insightful and important.
Okay, now there's 3 things I want to get to before the end. I'm just going to ask one now, but one's going to be about case studies from kids that you've worked with just to prove point. The other's going to be about thermoneutrality. There's no show I ever do about health where I don't talk about ice baths, because as Bobby knows, I love ice baths. I do them every day. And you know what? I'm actually going to start with that one before I get to alcohol. So when I do an ice bath, I do an ice bath in the morning and then I'll work out afterwards. Good hard workout, 50 minutes. I can literally feel my metabolism shoot through the roof. I am starving the rest of the day. It's almost like there isn't enough food that can crave it. So I don't need anybody to tell me whether or not the ice baths are good, because this is not a challenge to you, but just of the research. I can feel what they're doing. Do you place any emphasis on the problems with living at thermoneutrality, the benefits perhaps of kicking your mitochondria into another gear to keep your body warm for that shit? Or is that not your purview?
Yeah, I don't focus too much on that. And I think a big part of it is because I'm kind of a wimp. And when it comes to ice baths and things like that, hell no, not for me.
5 times, 5 ice baths with a workout afterwards. One guy at work said to me,
all you back to California, he doesn't want to be cold.
Yeah, I forget that.
At work, someone said, you preach this ice baths for 1.5 years. Has anyone ever listened to you? I said, well, my wife kind of, but that's it. But Bobby has, right?
Yeah, I have.
Okay, so now you go.
I mean, it's definitely a self-selecting activity, I think. The people who do it love it and feel great. If you're not going to love it, you're not going to do it, because it's miserable if you don't love it. I think that's how I see it.
I agree. Okay, good. We'll put that aside then. Let's move to alcohol. Okay, so I've considered myself in pretty good metabolic health, particularly over the last 1.5 years. I still probably have a drink and a half 5 nights a week, maybe 2 or 3 on the weekends. Is that blowing my whole thing or no?
Yeah, it's a good question. Alcohol, it used to be the mantra that moderate alcohol was actually good for your health. And it was only alcohol in excess that was bad. Now the tide's changing a little bit. And, it is true that the dose makes the poison. And there are people who are fast alcohol metabolizers, slow alcohol metabolizers. So they're going to tolerate alcohol differently. I wouldn't say a drink and a half is undoing everything you're doing. And again, that needs to be individualized, and that you can test, right? You can test what your blood sugar doing, what your insulin doing, what your triglycerides doing. And if you drink more alcohol and you see those going the wrong way, okay, that's going to tell you something. If not, then, maybe you're a fast metabolizer of alcohol, and a drink and a half for you is the same as 3 drinks for me, right? And whereas that would just destroy me and I'd feel terrible and it would undo my health. Yeah, so that there's not one right answer there for sure.
So I want to show something. I've shown this on the show before, and this is not any sort of humble brag, because I did nothing to do this except eat all the meat I could get in my gullet. That's before and after.
Yeah.
Move it a little bit to your. Yeah, perfect.
He just wants it to cover my face.
Yeah, I want it to cover your face, because I hate. Yeah, your face.
That's in the same house, with the same clothes on. My wife actually posed me because she knew that she had the fat picture. And all I did was eat all the meat. So 2 things happen, and this is for the audience. When you eat a 1 or a pound and a half ribeye at 12 o'clock, you're not hungry till the next day at 10, 11 a.m. You're just not. And you're not craving anything. Please, if I'm wrong on any of this, Dr. Scher, just jump in. I'm not craving anything because my body is satiated, both in terms of the amount I've eaten and the nutrients that I've taken in. That's number one. The second thing I want to ask about is I spend a lot of time, I've been lifting weights since I was 15 years old. My brother was an amateur champion power lifter. He's older than me. When we were in high school, he held the Illinois bench press record for a while. So I just lifted weights with him. And I watch a lot of fitness YouTube, but I try to stick to the guys with PhDs rather than the guys that are doing trenbolone and anabolic. So I watch people like Dr. Mike Israetel, for example, or Dr. Lane Norton, and I'm calling them doctors because they have PhDs in exercise science or whatever that particular science is called. And they are very much fans of saying a calorie is a calorie. As a matter of fact, Dr. Mike Israetel recently said, you can eat 1,600 calories. He didn't say exactly this. I'm paraphrasing. You can eat 1,600 calories a day of sugar, of white sugar. And if that's deficit for you, you'll lean out. I don't believe that. One of the things I've experienced with carnivore is I don't lose muscle, even if I stop working out for 2 or 3 weeks. And I put on muscle very easily. That's the positive. I want to talk to you about the negative as well for me, but go ahead. Do you agree with that kind of stuff, or are they just, that's what they were taught?
Yeah. So look, if you're talking about a caloric measuring device, what's called a bomb calorimeter, and you're talking about like the thermodynamic equation and the chemistry, yeah, a calorie is a calorie. But now equate that to the human body. We are not a bomb calorimeter. We have, hormones, and we have body composition and muscle and fat and metabolic dysfunction and cravings and emotions and a brain. And then all that calorie junk just completely goes out the window. I don't know how anybody thinks that can be a helpful representation as it applies to a human being eating food. But where they can say they're absolutely right is yes, on a chemistry and a formula standpoint, yes, but that's completely unhelpful. Yeah, I think they're being disingenuous then.
Well, and that's that old energy balance model, which is a bullshit model. It's all about insulin and insulin resistance, right? That's to simplify it, right?
Yeah, I mean, look, calories matter. You can overeat fat. You can overeat protein. It's challenging for a lot of people to do, but it can be done. And compare that to, overeating carbs. But calorie per calorie basis, you're going to be much healthier and do much better if you eat, 1,000 calories that's protein, fat, and a little bit of carbs versus 1,000 calories that's almost all carbs. Those are completely different scenarios in your body and are going to affect your insulin sensitivity, insulin resistance, metabolic dysfunction, body composition, hunger. It's going to affect all those very differently.
So I want to just throw this out because I'm an overly macho guy, as is Jim from Chicago. Like we're the definition of what they call toxic masculinity on a social level. But, it's part of the reason I don't like the word diet. But I was at a restaurant with a friend of mine, and they were out of ribeyes. They were out of New York, but they had a 12-ounce filet. So I ordered a 12-ounce filet. He ordered the same thing. They said, you want the sides? We got mac and cheese. We got this. I'm like, no, I just want the steak in the middle of the plate, bring some salt. And the guy behind the bar was like, what are you on a diet? And they all were kind of chuckling because I was on a diet, right?
Yeah.
Well, now they come and ask if we want dessert. My buddy orders cheesecake and I order a 6-ounce filet. All of a sudden, I wasn't the guy who was on a diet. I was, I believe this guy is eating 2 steaks. So that's fun for me. The actual is this. So I pray that I'm a lean mass hyper responder. I don't know if I am. And I was so mad in the interview you did with Lauren Kennedy West when you said, people ask me if I'm a lean mass hyper responder. I'm like, I don't know. I'm like, damn it, I was going to ask you if I was. My cholesterol about doubled, a little bit less than that. And I didn't care about that, to be honest. In 2019 in Chicago, 75% of the people that went to the emergency room with heart attacks had LDL cholesterol below 200. So I don't honestly, to me, that's like a disqualifying factor of cholesterol. Although maybe that's me talking my book. My triglycerides are elevated. And after about 8 months, 9 months of carnivore, they went from 217 to 214. So that bothers me a little bit.
Yeah.
Right?
Yeah.
And I don't know. That's why I'm hoping I'm a lean mass hyper responder, which if you could please explain that to people, because I don't want to stop what I'm doing. I don't want to change it. So please, the floor is yours.
Yeah. So I'll get to the lean mass hyper responder, but go back to the steakhouse you were at. If you would have had the full plate of mac and cheese and the baked potato, nobody would have thought twice about the junk you're shoveling into your gullet, but they were shocked by your steak, right? So it shows you how off we are. Okay. Lean mass hyper responder. So first, what is a lean mass hyper responder? So a lean mass hyper responder is a term coined by an engineer, Dave Feldman, and now has been published on in the medical literature that defines this phenotype meaning just like a certain way people react, a certain type of person who is lean and metabolically healthy and goes on a ketogenic diet and whose LDL skyrockets. Now, the way he defined it, the HDL is high and the triglycerides are low. That's his definition. But at its core, the physiology is that the body hypothesis is that the body is burning fat for fuel and therefore needs to traffic all these triglycerides and fatty acids in the body so you can use them for energy. And as a result of that, that causes the LDL to rise. So if you don't meet the exact criteria as defined by HDLs and triglycerides, you could still have that physiology, right? So are you a quote unquote lean mass hyperresponder? Well, maybe not as defined for that specific term because your triglycerides are up, but you still could have the same physiology and the same reason for your LDL elevation, in which case I'd still consider you a lean mass hyperresponder, just, maybe not by the definition.
So then,
yeah, go ahead. Sorry, go ahead.
No, it's okay. Please finish your thought.
Well, I was going to say, so the question then is that dangerous or not? And that's a whole nother, can of worms that we could get into. But please, if you had another question, let's do that first.
What I was going to ask you is, so years ago when my cholesterol was, I opened up for this. It was 320. It's now like 570. Okay. So, but I'm talking 320, 20 years ago, right? Mm-hmm. And a doctor said to me, I think I want you to take statins. And I said, okay, I'm 50. I'll be 59 this year, by the way. And I said, no, I'm not taking them. Now, it's interesting to me because I don't blame doctors for a lot of what they do at all. I don't. Talking to Dr. Sean Baker, he said, yeah, when I was in medical school, he was I don't know if you know, he's an orthopedic surgeon. He said, when I was in medical school, we got about 40 minutes on nutrition. That was it. So I don't blame the doctors. This is what they were taught to do. And I don't think that I've never met a doctor that I thought was malicious. Maybe I'm naive. When they told me they wanted to put me on statins, I said, no. I went back. My cholesterol was still elevated. Doctor said, so you're just not going to take these? I said, no. And she said, well, why? I said, because I don't want to take a pill that I don't feel like I need. Now, in between those two appointments, I went back as far as I could in my Italian immigrant history and found tons of high cholesterol and 0 heart attacks. 0. So I said, and at the time, I may have been misguided in this belief. I'm like, it's got to be more hereditary than cholesterol driven. You tell me if I'm right or wrong about that. But that's the reason I said, no, I'm not going to take it. So she goes, okay, will you please go to GNC and get some red beetroot then or something and take some of these natural remedies. So where in all of that am I insane? Because statins were just always a non-starter for me, being a weightlifter, already having joint pain from the bad food I was eating. Where am I nuts?
Yeah, I mean, you're spot on in that LDL itself is not the disease. The disease is heart disease. So can high LDL increase the risk for developing heart disease? Sure. But how much and for whom are the main questions? And what does it mean for me as an individual? What does it mean for you as an individual? Rather than some general study of tens of thousands of people shows a slight increased risk. So actually, I just did a video at Metabolic Mind where basically I say, why are we basing our decisions on heart disease on a blood test when we can just measure for heart disease? I mean, we have calcium scores, we have CT angiograms, we have carotid ultrasounds. Like there's so many better tests we can do to look at our blood vessels rather than trying to treat one blood marker, which may or may not be related. And, all you have to do is look at the evidence from people with familial hypercholesterolemia. So a genetic mutation that you're born with where you have very high LDL cholesterol. And yes, a subset of those people are much more likely to develop heart disease, but there is a subset of people who do not develop any heart disease, and the difference between them is not their LDL. They both have dramatically elevated LDL. So there's clearly more to the picture. Now, I wouldn't say LDL is worthless and you should disregard it, but when it comes to kind of putting the big rocks, you put fill your bowl with the big rocks first, the most important things, and then add the little rocks. The big rocks are your metabolic health, are whether you smoke or not. Those are much the bigger rocks than the LDL. It's not not that you can count out the LDL or the ApoB, but you have to put it into proportion. And yes, absolutely, genetics is a huge part of that for sure. But again, as doctors, we say, oh, well, we can't treat your genetics, so we're going to treat what we can treat. Your LDL is up. I'm going to do something. I'm going to be proactive. I'm going to help you. Here's your prescription. But that's unfortunately too short-sighted and too generalized and not personalized to you.
So, and by the way, if you ever, this is not a live show. We do some live shows. And if you ever say something that you want to rewind the tape and cut it out, we will. I'm about to ask you a question. I don't want to put your reputation. Just say it. I won't answer that question. But you look at the machinations that go from high LDL, statins, the patient, the unholy triangle of the three. When you see that system and the amount of statins that are prescribed, the bullshit meter is 10 being it's a bullshit scam that they're pushing statins because they're the most profitable drug that's ever been in history, or 0 being it's not a scam at all. Where do you, Dr. Bret Scher, feel on that scale?
Oof, that's a good question. So I'm going to do a little dodge. I'm not going to give you a number, but because I don't know about the word scam, right? Like, so scam by whom and where do you place the scam? So again, sort of like Bob was saying.
That's a question because I can answer it. Right.
Well, let me give the answer. Let me give you my answer first, and then I want to hear your answer to where you mean by scam. So, but like Bobby was saying about, the doctor themselves, right? Like he hasn't met a doctor that he thinks was malicious, right? So it might not be a scam from the doctor, but it's easy. It feels good to help the patient. It's being, kind of almost mandated from up above by guidelines. The research is focused on this. So it's what the doctor knows. So because of that, I feel a little off calling it a scam, but I do think it's excessive. I think it's out of line. I think it's inappropriate when you look at the patient themselves and look at all the things you can do to improve their health that don't involve a prescription. And you look at the absolute impact that the prescription is going to have. Now, of course, that depends on, do they have heart disease? Do they not? What's their family history? What are the risk factors do they have? All those things go into it. But that's how I would answer. So let me hear you though. What do you think? Where does
so the scammer? Because I agree with Bobby and I agree with you. I think that the medical doctors that I have gone to, I have loved. They all have my best interest in mind. I am talking about the unholy alliance between the big pharma companies, between the AMA, and their licensing agreements, whatever they have. I think there is somewhat of a pressure for these doctors to prescribe certain things. And I think it becomes very easy for the doctors to fall in line and convince themselves that they're doing the right thing, despite the fact that their intentions were wonderful and great getting into the practice. Is that too cynical?
No, I don't think that's too cynical. And it is, it's absolutely abhorrent and ridiculous and whatever other adjectives I can come up with that I get the Journal of the American College of Cardiology, every week, and right on the front is an ad for a drug. Like what? This is objective research, supposedly objective research that you're supplying for me. And right on the front is an ad for a drug. And you look at, who sponsors the American College of Cardiology, the American Heart Association, the American Diabetes Association,
Pfizer, baby,
drug company, ultra processed food company. Like who's sponsor? How is that even legal and allowed in what's supposed to be objective health advice, health recommendations to make us a healthier country and individuals? I don't even know how that's allowed.
I got a statement and I got a question. The statement is, if you are going to be affected by the USAID shutdown, please let our audience know, because we're pretty good at selling books and raising money for causes that are worth it. So you obviously, your study is in cardiology and you are now working on the effects of a ketogenic style diet, whichever one it is, on the mind and mental health. So Jim and I have sort of two soft goals for each other. He's trying to get me to stay in a cold plunge tub for like 162 minutes at 6 below, something like that.
Good luck.
I'm trying to get Jim to try drinking socially at no other time, right? I think he's going to get to me before I'm going to get to him, I think. But
it's been such a habit for me. Every night I pour myself a glass of wine. Yeah, but anyway, go on. Yeah,
I watched a show with Colin Farrell called Sugar, and he plays a detective. His last name is Sugar, like a old school, what do they call it? Used to call him Dirtfoot, Clubfoot. I don't know. And he's the one that I stole that phrase from. He's like, I've got a condition where I can't get drunk, but I love the romance of a drink. And he's like swirling his drink around. I'm like, that's it. That's what I miss. I don't miss the taste of it. So for somebody who watches this and says, okay, I've got either depression I can't shake or anything. ADHD I can't shake, or craving for alcohol I can't shake. And by the way, none of this is medical advice. This is a freaking interview show by two knuckleheads talking to a really smart guy. What is the sort of process you would recommend people to say, okay, I need to try this, but I just don't believe. I think the idea of going cold turkey scares people. And I will tell people from a carnivore perspective, it took about 6 days. And then all I craved was another steak.
Yeah.
What's the process that people can go about it?
Well, first and foremost, the process is if you can find an experienced clinician to work with, do so. Now, what is a clinician? It doesn't have to be an MD. It can be a nutritionist, could be a health coach, could be a therapist. There's so many other layers of clinicians who can help you in this process. You are trained in ketosis. And that's important because that term cold turkey makes a difference, especially with ketosis. If you go cold turkey into ketosis and you're not prepared, you're going to feel like crud. I mean, it is your body literally sort of detoxing from all the carbs and having to use the glucose for fuel, and you pee out a whole bunch of sodium and you lose your electrolytes in it. You feel terrible. But if you can do it in a more gradual fashion, if you can be prepared and hydrate and take electrolytes, all of a sudden it's a whole nother scenario and you're going to feel much better. So being prepared and working with someone who's got that experience is really important. But then once you're into ketosis, when it comes to ketones in the brain, I mean, we see so many examples of people say, boom, the lights turned on. Everything changed that quickly, which is amazing. Now, not everybody feels that, of course. And, the experts in this field, Dr. Georgia E., Dr. Chris Palmer, they all say you got to give it 4 months before you can really say you've given it a trial. And don't get sort of romanticized by those individuals where it happens right away and think it's going to happen to you. But it is dramatic that it can happen that quickly, which just shows how the brain can change when you change its energy production, when you change its fuel, and when you alter its metabolic health. I mean, it's pretty impressive.
I do have a follow-up question, but I want to throw out like a hint to people. If you're used to having a side with your steak or with your burger, you get a burger with no bun and you're used to having a side. One of the things that worked for me was like sort of soft scrambled eggs with a little bit of grass-fed butter on top. Really did. Because I think sometimes with a dish, it's like the change in flavors and the loss of the monotony. And then I'm telling you, give it like 2 weeks, 3 weeks, you won't crave anything else. My follow-up comes again from the interview you did with Lauren Kennedy West, who I feel like we should have on the show now that we've mentioned her this many times. I've mentioned her this many times.
Yeah, she's phenomenal. I mean, her story and the way she documents it and her YouTube channel, highly recommend everybody check it out. I mean, it is inspiring. You're going to laugh, you're going to cry, you're going to just feel amazing by watching her journey. She's an incredible human being.
All right, so look for Lauren Kennedy West and look for Metabolic Mind on YouTube and follow both of those. And follow us too, by the way, you knuckleheads.
How about it?
The follow-up question is, during that interview, you said ketogenic diet, whether you're doing carnivore, whether you're doing an adjusted keto, whether you're doing a vegan diet. That struck me. I remember thinking to myself, how in the hell do you do vegan keto? Yeah. Right? Is it a giant plate of avocados and you pour olive oil all over it? How do you do vegan keto?
Yeah, it's a lot of avocado and nuts and olive oil and vegetables. I mean, and then you're going to have your protein somewhere. So usually tofu, some soy-based protein. It's going to be probably the most challenging form of a ketogenic diet, but it is doable. So, I think it is so important to realize that ketosis is a physiologic state and a metabolic state and not a diet. So if somebody wants to be vegan for ethical reasons or for whatever reasons, just the way they were raised, you can do it. It's going to be more challenging and require more work, but you can do it. And the easiest way is going to be carnivore. You just throw a big steak on and that's what you eat for your day and you're done, right? And then there's everything in between. There's Mediterranean, there's other versions of omnivore. All of those can be ketogenic in nature.
Because there's something in the range of, Jimmy, like 9 to 10 carbs in an avocado, like in a half an avocado. So I just think you got to be a hell of a lot more vigilant. But
yeah, well, with avocado, the net carbs are going to be very low. So that's the other thing. Are we talking total carbs or net carbs? Because the avocado is going to have a lot of fiber. So, the general rule is that if you're talking about natural foods, you can generally go by net carbs because
net carbs is not a scam. Unless it's bread.
I don't think net carbs is a scam unless it's the bar that's got all the, chicory root fiber and all the added fiber and stuff, and your blood sugar still goes crazy. And
it's got a ton of sugar, right? Yeah.
Yeah. If it's a processed food, then go by net carbs. If it's a processed food, go by total carbs. And if it's a natural food, go by net carbs is my usual advice.
Okay, before we go, in a couple minutes, we're going to be running up against the clock, but I want to talk about some of the success stories you've had. Particularly, I'm more keenly interested in teenagers. I think they have a tougher go of things than adults. I don't know. I tend to like kids better than adults too, but that's beside the point. So can you tell about some success stories, about the level of success you're having? Because what I ultimately want, I believe this is powerful shit. I want you to paint the picture so people go, okay, wow, yeah, this does make some sense. Could you tell us some case studies?
Yeah. So one of the beautiful things about my job is I get to talk with experts all day long and meet with the experts all day long. So I do not treat teenagers. I don't deal with teenagers individually. That being said, I've had amazing conversations and an interview with Dr. Lori Calabresi, who is a practicing physician out in psychiatrist.
Someone with an Italian name who's respected. Thank you for that. Anyway.
Right? Yeah, she's out in Massachusetts and Connecticut, and she's a practicing psychiatrist. And she published a case series of treating adolescents with ketogenic interventions. And we had a great discussion on the interview about the amazing changes she's seen. And look, I mean, there's no secret that mental health in teenagers is declining dramatically. And metabolic dysfunction likely plays an important role in that. And in brain energy likely plays an important role in that. So she has seen dramatic changes with ketosis. And, I highly recommend people check her out. Another one is, let me see if I get this right, CMHRC, the Center for Mental Health Resources. CMHRC, I forget exactly, but Elizabeth Errico for CMHRC is actually, her whole program is geared towards giving family support and all kinds of support for families with kids and adolescents with bipolar disorder. And she has now started a program of training them in ketogenic therapy. And the responses she's getting are phenomenal. Like the family is saying, I can't believe I never heard of this before. This has changed his life and our life. And thank you so much, right? These types of amazing experiences with people who haven't been able to find that type of experience elsewhere. Now, we don't have a lot of research on ketogenic therapies for mental illness in pediatric population and adolescents. It's coming, but we do in epilepsy. So we know it's safe and effective in epilepsy. So why wouldn't it be in psychiatry as well? And certainly by the anecdotal evidence, it can be remarkable.
Bobby, you got a last question?
Yeah, last question. I have a niece who actually has seizures, and she is 100% ketogenic. And it actually has managed her seizures to the point where she doesn't have to go to a special school anymore. She just goes right to a regular school.
That's great.
She's developmentally disabled because of the seizure she's had through her whole life. But she goes to a regular school now because there's such a low risk of her actually having a seizure during the school day with her ketogenic diet. This is the last question I have. My wife and I have some friends who just had a baby, and we're super close to them, and we're super in love with the baby. And we actually even joke that the four of us don't go out anymore ever since the four of us had this baby. How young is too young to be looking at this kind of a thing? I mean, obviously growing babies need just sort of all kinds of nutrition, I'm assuming. Mm-hmm. How young is too young to focus on more fat and protein and less of a varied diet?
Yeah, it's a good question. I would say there you don't have to be, there's no limit, would be my basic answer. I mean, again, going back to epilepsy, they put 2-3-year-olds on a ketogenic diet. Now it can be challenging to do. And in the epilepsy literature, they were using a very low protein ketogenic diet, and they did see some lower growth, but they always caught up later. So I would certainly recommend, adequate protein diet, and giving, higher fat, lower carbs. I don't think there's anything wrong with that. Now, as with anything, you monitor the individual, right? I have no experience treating 2, 3, 4, 5-year-olds. There's not a whole lot of research in that aside from epilepsy. So if someone chooses to do that, make sure you're doing it with a clinician on board and checking the growth chart, checking the labs, checking all the things to make sure it's appropriate. But, when did it become appropriate for us to be giving this much sugar and refined carbs? And nobody's thinking twice about that. Nobody's asking, where's the evidence that that's safe? Nobody's asking, is that okay to do? But golly, that's the one we should be questioning.
It's interesting to me, and this is my last comment, Jimmy, is that with all the research that you and Dr. Baker and Dr. Lufkin and Dr. Calabrese and everybody else that you mentioned, I don't mean to disrespect anyone and leave them out, that still this is all sort of in its infancy, right? The research. So it seems to me, at least through my experience and knowing Jimmy's experience, that a lot of these things are reversible if we find out this is the way we should have been doing it.
Yeah.
Day one.
Before I sign us out, I want to say one thing too, Bobby. I don't know if you saw this too. Just last Thursday of last week, University of California, San Francisco came out with this groundbreaking piece talking about something they act like they discovered called beige fat that competes for nutrients for cancer cells. Just why this is funny, Dr. Scher, is that we've been screaming about this for 2 years about how the mitochondria in brown fat sucks glucose out of the blood and leaves you in a more ketogenic state. We've been screaming about this. And these professors from UC, hey, guys, we discovered something. Yeah, Otto Warburg discovered it in 1931, you idiots. It's literally, he won a Nobel Prize for it. Learn a little bit about history.
And I don't want to get political because I'm not political in this particular statement, but I hope at least the confirmation of RFK allows more light to be shined on the kind of things you guys are doing. Maybe it will, maybe it won't.
What do you think? Do you think it will or won't? Are you glad he got confirmed, Dr. Scher?
Oh, 100%, because he is the only one who's been saying we have a health crisis and need to do something about it. Well, let me rephrase that. He's not the only one saying it. He's the only one making it his top priority and is willing to take on the corruption and willing to take on the influence from outside. And he's willing to take that on where I think nobody else has. And I think that's going to be so important to make this a topic of discussion that we're actually going to make impact with. So yeah, if he can live to that promise, 100%.
Just a one-word answer from this. In 1 month, how many ounces of alcohol do you normally have?
Very little. I don't even know how to.
That's not the answer I wanted.
How much is in a shot? 2 ounces?
Yeah.
I don't know.
Right. How many ounces is in a shot of whiskey?
Basically, you don't drink at all.
I mean, I'll have a glass of wine every other week and a glass of whiskey every other week, something like that.
I literally drink now because I don't want to explain to people why I don't. That's the only reason I do it.
I mean, it screws up my sleep. If I drink, I don't sleep, man. So that's what changed my world.
Yeah.
Sure. So you don't have a book, right? You just have the Metabolic Minds podcast, correct?
I've got a book from like 10 years ago. It's a little outdated, but you can still check it out. Your Best Health Ever. It's called Your Best Health Ever. And it's, it goes over a lot of myths that are out there in medical practice that we need to get rid of. And then I've got a website at Low Carb Cardiologist where people can find out about working with me, but most important is metabolicmind.org and the YouTube channel, Metabolic Mind, and the podcast.
Thank you so much for joining us. This has been eye-opening. And thank you guys for watching. The support you guys give us is humbling. All the DMs, all the retweets. We knew that our show was going to be somewhat successful, but not to the tune of 80,000, 100,000 views per episode like we're getting. And it's because of you guys. Bobby and I spent 20 years in legacy media. We always were at the whim of those assholes telling us what to think. We cannot be told what to think. And we might say stupid things, but they are honest, stupid things. Special thanks to our sponsors, Hardcore Italians. Go to the website. It is hysterical. The gear that they sell is fantastic. Use our promo code for 15% off. Our promo code is FU. It stands for Finance Unfiltered. So stop it, people, if you thought anything else. Special thanks to our other sponsor who was really going to love this show, Independence Arc Farms in Arkansas. Grass-fed, grass-finished beef. I literally eat their meat probably 3 times a week. And I own a restaurant that sells the other best meat in the area too. So literally it's like I go back and forth between Brandt's meat and Independence Arc meat, and I just cannot decide which is better, which by the way is a huge compliment to Independence Arc. Thank you guys. Thank you very much. I'm Jim Iuorio. That's Bob Iaccino. This has been The Future's Edge.